Hill here on DC News Now. So as we all know, one of the top issues of the shutdown was health care, specifically the extension of those Affordable Care Act subsidies.
All Republicans voted against extending them, many of them saying we need a whole new system of health care. Joining us now to talk more about health care in this country is one of the key architects of the Affordable Care Act, Dr. Ezekiel Emanuel. Dr. Emanuel, thank you so much for joining us. I want to talk a little bit about the Affordable Care Act. What was your vision with Obamacare when you first helped develop it?
Well, the main vision was to increase the number of Americans who had insurance. We were at about 14–15% of the American population not having insurance. That's about 45 or 50 million people. And then to decrease the overall healthcare costs to save the country money so that that money could be spent in other more productive ways. And we achieved both of those. We increased the number of Americans with insurance so that the uninsured rate dropped from about 16% to about 8%. And we saved a whole lot of money. Estimates are that over 15 years, we saved Medicare alone nearly $4 trillion. And that's not widely appreciated.
Dr. Maynard, I want to ask, when you all were coming up with the Affordable Care Act, did you factor in, hey, maybe we're going to have to use this system when there is a pandemic? Because that's sort of what this fight is all about. We had these subsidies put in place during the pandemic. Democrats want them extended. Republicans, some of them arguing they weren't meant to be permanent. They were just here because of the pandemic.
Well, the reason we put them in is because costs in the exchanges went up during the pandemic, especially in that first year, because of the tremendous need during that particular moment. And so that was a very important issue. You had to get people insurance and make sure that they actually got coverage so that they could use the facilities when they got infected with COVID or thought they might be infected with COVID. No one anticipated that the demand would be so high. But I think more generally, we are having a problem with our healthcare system. We in the United States spend 17.5% of our GDP. That's one out of every $6 in your wallet on healthcare. Every other country in the world, we're talking Germany, Switzerland, Norway, rich countries, spend about 12% of their GDP on healthcare. We could do a lot better, and we tried to do a lot better, and we did save money. Projections are we'd go over 20%. But there is a problem. These subsidies actually work. More people get insurance when they have the added subsidies to buy healthcare insurance, and that's very important because we know that insurance saves lives, that the more people who are insured, the more people have their life saved, that for every between 300 and 1,000 people who get insurance, actually one person's life is saved.
What would you say are the consequences of these subsidies expiring?
Oh, lots of people are going to lose their insurance and people are going to die. It's that simple.
Wow, okay. Doctor, I want to ask you, has the Affordable Care Act sort of evolved in a way that you thought it would when you look back, to 2010 when it ultimately was passed? Was it just supposed to sort of be a starting point, and has it changed in ways that maybe you didn't expect?
Well, I would say that there have been problems. Every system has problems. I don't know a single corporation where you put in place a strategic plan and you don't constantly modify it as things change. And the problem with Congress is we put in the Affordable Care Act and, the Republicans have tried to undo it, not to join together and think, well, what modifications does it need now that we've seen evolution? If I had to identify two problems, one of them is the system's become so complicated. It's so hard for patients to navigate it, doctors to navigate it, hospitals to navigate it, and complex systems also allow a lot of gaming of the system. So people making money when they're not actually helping improve people's health. That's a very serious problem, and we need to simplify the system. The second, I would say, is that we have a lot of, partially as a result of the complexity, we have a lot of diverse opportunities, different insurance plans, different drug policy plans. That complexity is also a problem. It dramatically increases administrative costs. We spend $1 trillion in healthcare on administrative costs, and we can shrink that by hundreds of billions of dollars. And that we haven't focused on at all in this country. And I think that's another major problem. And the last thing is, despite all our efforts, we still have 8% of the population, even before we cut the subsidies in the exchanges, 8% of the population without insurance. In a modern country, that's unacceptable. Nobody listening here would want to be uninsured. No senior executive at a corporation wants to be uninsured. No member of Congress wants to be uninsured. Why should Americans, most of whom are working, I should remind you, but their employer does not provide health insurance and they don't earn enough to buy in the exchanges, go without health insurance? We need a better system, take some of that administrative cost and get everyone health insurance.
As you know, President Trump has not put forth a formal plan for health care, but he has shared some ideas he has. Let's hear from the president on health care.
And I'm calling today for insurance companies not to be paid, but for the money, this massive amount of money, to be paid directly to the people of our country so that they can buy their own health care, which will be far better and far less expensive than the disaster known as Obamacare.
Doctor, what would your response be to the president's remarks about health care?
First of all, let me emphasize, it's been 15 years since we passed the Affordable Care Act. Republicans have been saying we need to reform the system, we need to reform the system for that whole time. Remember, repeal and replace, there was going to be a replacement, a better system. I'm waiting. They still haven't produced one plan coherently that would do anything to lower costs, improve quality, get more people insured. They have done absolutely nothing. There's no Republican plan in 15 years. They have no ideas about what to do on healthcare. This is a terrible idea. You're going to let individuals try to negotiate with health insurance companies, individuals, some of whom have cancer, where the insurance company is going to look at them and say, well, we don't really want to cover it, and you're going to give them a small amount of money, maybe $5,000, $10,000. You get cancer, and right away, if you have breast cancer, it's about $80,000 for the chemotherapy, all the scans you need, the surgery. This is a terrible idea. It's a non-starter. It's going nowhere. Donald Trump doesn't understand the complexities of the healthcare system. He admitted that himself before. And this just shows he doesn't understand the complexities of the healthcare system. This isn't even, there is no serious person in healthcare who would think this is a good idea.
Dr. Mayor, we got about 45 seconds left. I want to take a sort of 35,000-foot view of healthcare in the U.S. Obviously, HHS Secretary RFK Jr. has made some controversial decisions when it comes to the American healthcare system. What do you think maybe the administration is getting right, and what are some of the things that you may not agree with that they've done?
The best thing that they've done is that they've identified chronic illness and diet as critical problems in our American healthcare, not just healthcare system, but the health of the American population. And that is true, and I totally agree with them on that. I don't think they're doing enough in that area, in part because you have to change the food supply in America to really affect the obesity epidemic we have and all the downstream effects, the diabetes, the wearing out of joints, and many heart disease. That's the main thing they're getting right. Their policy on vaccines, their policies on medical research, especially things like mRNA research, their policies now on the exchanges, reducing the open enrollment period, the work policies on Medicaid, those are not good policies. They're all meant to undermine medicine, undermine the care Americans get, reduce the number of people who are going to have insurance, and we're going to see tremendous adverse events. We're going to see renewed infectious diseases like we have with measles. We're going to see less research and less breakthroughs. and we're going to see a lot more American coverage who are suffering, and some of them, unfortunately, thousands of them, unfortunately, are going to be dying as a direct result of the policies of this administration.
All right, Dr. Ezekiel Emanuel, we appreciate the time on this Friday morning. As this debate continues towards the end of the year, would be great to have you back on to go over any sort of plan that may be coming from the White House or the GOP. We appreciate it. Thank you so much.